so we'll let them do that, but we'll go ahead and get started now. So welcome to the 75th anniversary weekend of the School of Public Health. And this is the 4th event of the week, or the weekend. Hopefully some of you were able to attend the fabulous party last night. So the celebration continues today. And my name is Marta Cieslak, and I'm the president-elect of the School of Public Health Alumni Association.
And I'm Sarah Ismail, and I will be serving as the vice president of the Alumni Board next year.
So we want to welcome all the honorees and alumni that came to Berkeley for this wonderful celebratory weekend. So I'm going to ask that our honorees stand up. Can I have all my honorees stand up? Wonderful. Thank you. And do we have alumni couples and family in the audience? Raise your hand. All right. Awesome. Well, welcome. So we have a very special guest with us today. So we have the School of Public Health Deans, past and present, that will be doing a panel with us in about 15 minutes. And that panel is moderated by our wonderful honoree, Hosang. So we look forward to hearing from them shortly. In the next couple minutes, Sarah and myself would like to give you a little bit of an overview of the Public Health Alumni Association. How many of you have either heard of the Alumni Association or have been to one of our events in the past? Great, wonderful. That's amazing. So our board is volunteer-based, comprised of about 18 members, board of directors, and we're a very diverse group, so we recruit from all years of graduation, all concentrations. We also have student representatives on our board. So we're always looking to recruit, so if you're interested, please let us know. We do a variety of activities throughout the course of the year to support our mission and goal of the board, which is really to foster relationships between alumni and the school and current students. So I will hand it over to Sarah to talk a little bit about some of our activities that we do throughout the year. So you could learn a little bit more about that. And again, we always welcome volunteers, or if you're interested in applying for the board, we welcome that as well.
Thank you, Marta. So the Public Health Alumni Association has 3 goals, and I consider them like umbrellas. So our first goal is professional development, and what comes underneath that is things like webinars. How many of you have followed a webinar before by the School of Public Health Alumni Association? Yeah, so we have a few people in the back. We'll make sure to send those out as well. If you would like to volunteer and give a webinar, please contact one of us later, or you can email Eileen at PHAA, that's for Alumni Association, at berkeley.edu. Our second umbrella is events, networking, and resource mobilization. Some of that includes happy hours, alumni-hosted dinners. So what we are doing right now is we have a lot of public health students who would love to meet alumni. And if you are local, you could host a small dinner at your home and have students either bring food with them or cook yourself for the students. So if you're interested in that, also contact one of us or email Eileen at PHAA at Berkeley. Our last goal is increasing diversity diversity and scholarship at the school. And we have a few ways of doing that. The Alumni Association is involved, closely connected to the school to make sure that we recruit diverse students, faculty, and we're also working on the dean search as well. And also we have our second annual diversity scholarship. We raised enough money to support. I say annual because last year was our first time doing this. This was our second year. We raised enough money for 7 to 8 students to give them $2,000 scholarships. And we will be doing this every year, so watch out for our video and our fundraiser. I'd like to thank you all here for being here again, and in about 10 minutes we'll start our Dean's panel. We have a special comment from Dr. Madhu Pai, one of our honorees. Dr. Madhu Pai would like to say a special word.
Good morning, everyone. I'm so happy to be here for this event, and I just wanted to take this chance to thank the school. Can I have your attention, please? Hi. So my name is Madhu Pai. My wife, Nikki, and I left India 18 years ago to come to Berkeley for our training. I still remember the day. It was a fall morning and we started walking into the Berkeley campus for the first ever time, never having seen the campus. We walked past the old Warren Hall, which is something else today, and then walked up all the way to Haviland Hall and Campanile and Scout Plaza. And I still remember we literally pinched each other and we said this couldn't be happening to us. We must be dreaming. Berkeley looked like a magical temple of learning, and we looked at each other and said, we better make the most out of this opportunity, which is what I think we did. We cleaned up. My wife got 2 degrees from Berkeley. I did my PhD and my postdoc here at UCB and UCSF, and we've never really looked back since our days. So we are infinitely grateful to the school. I don't think there could have been a more life-changing experience than our training here at Berkeley. And we are very keen to give back and also pay it forward to the next generation of students. I have 2 of my teachers here, Art Reingold and Jack Wolford, and I couldn't be more thankful to them. And so to honor Art, who gave us that single biggest life-defining break in my life, we started an award called the Arthur Reingold Global Health Award. And I'm so pleased to say that because of the generosity of art students, we have raised almost $250,000. And we are hoping, thank you. It just seems that life doesn't give us an opportunity to give back to your school and thank an amazing mentor at the same time. And that's exactly how we saw this opportunity. It's not just me, so many of art students wrote back and said, oh my God, art gave us this amazing chance, taught this amazing course, inspired generation of students. I cannot tell you how many countries there are people who have been trained by art who are now leaders in their field because of the amazing work that the school did. So the fund is open, and we're hoping that we will give the first award to a low-income country student sometime later in fall or next year. And we would love if anyone else wants to contribute to this award to keep it growing so that we can actually give tuition fee waivers and other things to support students from low-income countries. Again, thank you for this time.
Good morning. Good morning. We knew that we wouldn't get you to a brunch without trying to do something that was entertaining as well. My name is Hosang. I am from the MCH faculty at the school, and it is my duty today to moderate the panel of deans who will be joining us on the stage in a moment. Thank you so much for coming out on such a beautiful day. This building, some of you may know, is a Julia Morgan architectural design building, and it's really quite a pleasure to be here in such a lovely space for an event like this. You'll find on your tables some index cards and a pen, and those are there for you to write any questions that you may want to put to the panelists later on. And we'll have someone in the room picking up those cards after we've proceeded for a while, so that those questions can be asked in the question and answer session. The folks who will be joining me on the panel. So just to repeat, there are some index cards on your table with pens, and later on when you've written your questions on those index cards, we use them to direct questions to the panelists at the question and answer period. I'm going to now invite the 4 deans of the School of Public Health, starting with Dean Emerita Joyce Lashof to come to the podium. While Joyce is on the way up, one of the things I mentioned earlier, which I think no one heard, was that this building is a building that was designed by Julia Morgan. And it's really a pleasure to be in a space like this for an event like this. Joyce Lashof was the dean between 1982 and 1992. And when I joined the School of Public Health and Maternal and Child Health in 1984, she was the dean. And I remember her dearly because she created for me an opportunity to do many of the things that I subsequently did in my career. Escorting Dean Lashof to the podium is Dean Stefano Bertozzi. Stefano. Dean Bertozzi is our most recent dean. He started in 2013 and is still with us. And he has presided over that lovely building that we all saw last night, its opening, and that has been the dream since the tenure of Dean Steve Shortell. So we're very happy that we had the opportunity on the 75th anniversary to have a peek at what it might be looking like. Next, may I invite Dean Emeritus Ed Penhoet to join us. Ed Penhoet was the dean between 1998 and 2002. And he followed on from Dean Patricia Buffalo, who is no longer with us, and she had the deanship during a very challenging time with the school, and we are sorry that she's not here to join us today. And then finally, we have Dean Stephen Shortell. Was dean between 2002 and 2012. So that rounds out the group. I am going to be asking the deans a few questions that relate to their tenure. So I'll start with Dean Lashof, because she was the earliest dean of the group. Considering the school's values, strength through diversity, health as a right, educational innovation and research that matters, that has impact, which one of these would you like to talk about today?
Well, probably health is the right is one of the most important. Okay. I said I think health as a right is being the most important issue that continues to be at the forefront of any public health policy. And I think when I was dean at the School of Public Health, one of the things that I brought that I thought was innovative and helpful, and I think continues today, was to really marry public health and medical care, not see them as two separate entities. And we developed a program, and many of you remember, as community-oriented primary care, where we developed the links with primary care health centers that were just being developed as part of the war on poverty during that period of time. And those have continued, and I think that makes a big contribution. The other thing that sort of was fun at the school when I was there was the joint medical program, which was the only medical school program on a general campus that didn't have what wasn't a separate health sciences campus. It was a general education campus. And the joint medical program was between UC Berkeley and UCSF. And just before I came, there was a move to dismantle it because it was a separate entity and had a large administrative staff, and it was very expensive for the students they had. And so when I was recruited, I asked that they not dismantle it until I saw what I could do. And probably the first school of public health to absorb a medical school into it, instead of the reverse, occurred. And we saved the program.
So I'm going to go to you now and ask you if you want to answer one of those questions, but I was hoping that you would tell me what the toughest challenge you faced when you were dean, and what did you learn, and what surprised you?
Well, I became prepared for the toughest challenge when I actually gave a talk prior to my being chosen to be the dean. So, as you all know, the process by which deans are chosen involves a search committee, and I apparently was selected by the search committee as one of the finalists, and then I had to give a talk to the School of Public Health about my work and my views of public health. So before I came to the School of Public Health, I was at a company, local biotech company called Chiron, where we had developed, we discovered hepatitis C, we developed all the blood tests to make sure that the blood supply was safe. We had a very large program trying to develop an AIDS vaccine, et cetera. And while I was there, I became more familiar with the School of Public Health than I was previously due to my service on the advisory board that Pat Buckler put together. So anyway, I gave my talk, and I thought, this is a pretty reasonable talk. I think hopefully it just gone over well, because I wanted the job by that point. And then afterwards, we were standing around talking, and two students walked by, and one said to the other, that was kind of interesting, but I don't see what it has to do with public health. So immediately I knew there was a challenge. And I think the challenge remains, frankly, is the diversity of disciplines that reside within the School of Public Health is, on the one hand, a very important strength, but at the same time, a challenge to get the various components of our community to actually respect and work together with one another going forward. So So the big challenge I faced coming in was try to understand this culture, because it's very different for me going forward. And then the second biggest challenge I faced was taking that culture and trying to improve the recognition by the rest of the campus, and the quality and the depth of what goes on in the School of Public Health. Because to some degree, the School of Public Health can tend to get isolated from the rest of the campus. So I think the next biggest challenge was to create an environment on campus where the school was valued and respected going forward, for what the great strengths that it does have.
Okay, Dean Shortell.
So I'll add to your first question, at least, and maybe a little bit on the challenges too, but in terms of the values of the school, the commitment to social justice, diversity, a part of that. During the time I had the privilege of serving the school as dean, we opened an office of diversity on campus. And some of you may remember Abby Rincon. And we recruited Abby. Yeah. She deserves all the credit here. We recruited Abby. She was over here at the Tang Center at the time. I think actually we were told that we were probably the first unit on campus to, at the campus level, have an office of diversity. We made a real commitment to that, and within, I think it was 3 or 4 years, we increased from 5% of the student body in the School of Public Health being underrepresented minorities to 25%. And that has held through time, and maybe that's even increased somewhat. A very important part of that was a gift we got from Kaiser Permanente shortly thereafter, $5 million or so, I think it was, to provide financial scholarship support to students who were not necessarily from underrepresented communities, but were going to commit their careers, some of you in this room, to reducing the inequalities that we still face. And so that put another shot in the arm. And then I was very fortunate, what Ed said is so true, and all of these up here will say that you constantly have to sell the school on campus for every opportunity. I had an opportunity during those years to recruit 21 new faculty to our school. And of those 21, 18 of them were women, and 4 of them were underrepresented minorities. And it's still the case that our student body is much more reflective of the diversity of California and our society than our faculty, but at least we're headed in the right direction. So I think those are some of the things the school did. And when we talk up here, it's not, about us. It really is about the faculty we have here and the staff we have here, the students, the alumni, you're all here. These are very much collective kinds of legacies. So I think those would be the ones that I would highlight.
Thank you. So I'll remind you that there are cards on your tables, and if you have any questions for any one or all of the deans present, just jot that down and we'll have Eileen and her staff pick them up in a minute. So Steph, pick a question.
Wow. Why don't I go back to Joyce's? And you mentioned 4 different values. And I think that in some ways, they're all very close to my heart. But I think the one that doesn't appear so often in other people's value statements is the last one, and that's impact first. And for me, what that value captures is the idea that any academic institution works on things that are interesting. But this academic institution works on things that are interesting and important. And while I think it's a core value of the school, I also think that as a university system, we're not as relevant to public policy in the state, at the local and at the state level, as we should be. So for me, it's a value that is core to our beliefs, but it's also one of the biggest challenges in front of us. I spent most of my professional life working in developing countries and working in academic institutions in developing countries that were directly responsive to the government. And when I came here, I thought to myself, we are Northern California's School of Public Health. Therefore, we are Sacramento's School of Public Health. We are Alameda County's School of Public Health. We're Contra Costa County's School of Public Health. We're San Francisco County School of Public Health. And when they have a problem, they should call us, and we should be responsive And for me, it's a challenge that remains, I think, an essential challenge, because they do, and we respond, but not to the degree that I think that this great university system should respond to those challenges and should be engaged. And it's hard because, of course, we value our academic independence, and we don't want to be seen as lackeys of our policymakers, and especially in an environment in Sacramento where the contributions of the UC system in particular are devalued because they see us as elitist and not serving the core needs of the state. So I think it's a really interesting challenge for us going forward, is how we can be even more relevant. I mean, we have shining examples of how we are already. John Baums is on the Air Resources Board is just one example. We have many other ways in which we contribute to policymaking in the state. But it's interesting for me, the fact that my phone has never rung from the secretary in Sacramento, and when I was in Mexico, it rang all the time. And so for me, that's an interesting challenge going forward.
Steve, do you want to make a comment about that?
Sure, I think Steph absolutely has indicated the tension and the challenge of doing that, but I also think we have tremendous opportunities to do that. And some of it is not just what the school can do or our faculty and so forth, it's what you all in the audience here, as alums in the positions you're in, can influence policy here in the state. And you know how to gain access to us where we can fit in and contribute. So I think it's a collective kind of challenge. And there are ways of doing this, as we well know. It's done in other states where you maintain your independence, your analytic independence, and still contribute to policymaking. And in fact, enlightened legislators, and over time you learn which ones you can work with, recognize that the value lies in the independence of the university and the expertise. And yes, it's often the case that they will call on us only when we have evidence and data that supports their predetermined position on something. It's going to get them reelected. You have to accept that. But often, the important point is there's always pushback to get your data and your evidence in front of everybody as part of the debate. And I think we have a lot of opportunities to do that and to further engage here in the state, but also across the country and locally as well.
Thank you. So I'd like to remind you to write your questions down, and Eileen, would you arrange to pick them up for us so that I can get them up here? I have a hard stop that I'm going to try and respect. I wanted to switch gears a little bit and ask Joyce, what innovations happened while you were dean that you'd like to talk to us about?
One of the innovations was working directly with communities both in San Francisco and in Alameda, and developing more clinical work clerkships with those community clinics.
But if you remember, you were instrumental in the wellness letter.
Pardon?
You were instrumental in the wellness letter.
Yes. Yes, I obviously mention that first off because the wellness letter is now 2 letters. There's a General Health Promotion 1 and one Health After 50. And the interesting history of that is that the publisher went first to UCLA and asked whether they'd be interested in a joint venture with a commercial publisher. And they felt that they didn't want to do that. And so they turned it down and decided to launch their own health letter. So they came then to Berkeley, partly because of Sheldon Martin, who was well known as a brilliant nutritionist, with a PhD and an MD, and ran the program at the School of Public Health. And he thought we could really do a service to the community as well as raise funds for the school, and brought it to me. And so we took that up through the channels, through the dean, the provost, the president, and were able to launch the wellness letter, which is still going on and is now both in print and online and has a very large circulation online.
Can I just add to that now?
You've got some really good questions, sir.
Yeah, no, I just wanted to mention that John Schwartzberg has done an extraordinary job guiding the wellness letter in recent years, and the Health After 50 was actually Johns Hopkins letter, which we now own both of them. And with a new program that Priya's, Meta's shop has engineered, there now is going to be a partnership with Connect Well Health to take all of that material and bring it to the workplace in collaboration with them.
It's fabulous.
So it all started with Joyce.
Thank you, Joyce. So thank you very much for the questions we've got. They are really good questions, but I'm going to try and ask this one to all four because it has specific relevance for the future. It says, please share with us your dream or vision for the School of Public Health. What should the school ideally accomplish in the next 10 years? And maybe we'll start with Ed.
Well, I think that, that's a complicated question. Could engender a long discussion and probably should, because I think to some degree the school is at a turning point. I think we have to confront the reality that winning in the academic world is different than winning in the political world, in the policy world. And so unfortunately here, we have to do both. We have to be highly regarded and respected on this campus for the quality and the quantity of the research that's engendered within the school. At the same time, we have to be responsive to the public for many of the public health needs that the public has, and as Steph correctly pointed out, where I think we're probably not recognized enough for the role we should play in that world. So I think for the school, the most important thing is to confront this duality and to make sure that we both are respected and valued by the campus as a whole. And the academic values of the campus are, as I said, different than the values of the world at large. But at the same time, respect the role we should be playing in the application of public health to policy. So it's a tough duality that we're facing, but I think we must confront it directly and have strategies that really address these. We want to be a first-rate academic institution, but relevant to the needs of society.
Steve? And let me just pepper it a little bit to the question that came up subsequently. It says, what will the work of public health look like in 2030? And how does the School of Public Health prepare its students for where public health is going to be in 2030?
Okay, let me build on a little bit what Ed has said, and I'm reminded of the words of, I think it's Maya Angelou, who basically said, do the best you can until there's something better that comes along, or until you know better, and then try to do better. And if you think about that, this is what this is really about, is how we position the school to be able to do better and to have the kind of impact that Steph and others of us have talked about. So I may go a little bit further than what Ed was suggesting, not disagreeing at all, but public health at Berkeley, at a university like Berkeley, the campus where we're at, is more, if we want to have an impact, is more than our School of Public Health. It is the entire campus. It is, if you really dig under the social determinants of health, our School of Engineering, okay, our School of College and Natural Resources, you can go on and on. Our law school, the Haas School of Business, the Goldman School of Public Policy, all of which we have concurrent degree programs with, okay? So we are the ones that maybe, this is baseball season, some of you may remember Reggie Jackson, the Oakland A's, and he used to be with the Yankees, and he was the straw that stirred the drink, kind of. So our school may be the straw that stirs the drink of the impact on health. but it's that larger cup that we have to work with. I think Ed was suggesting that as well. So we have to continue to build those bridges, perhaps be honestly humble at times. We're not going to get all the faculty positions we want. We will never be as big as our East Coast competitors in terms of allocated faculty or students. That's just the reality we live within. That's the same for almost all the other professional schools at Berkeley. They're also ranked in the top 10. But we have to recognize the vast resources we have on this campus to impact health, and our colleagues also at UCSF and elsewhere in the Bay Area. 2030 is just around the corner, actually, and I think some of the main differences in training has to do with how we give our students the skills in the data analytic and data science capabilities, marrying that with the values that we have. And secondly, I would say how they become even savvier at moving money, ideas, and people through organizations. That's how you be effective, how you use the resources, the ideas, and the knowledge of the people in the organizations we're going to be working with. And I think we've got to continue to move actual knowledge as fast as we can in the classroom and then out into the field. So that would be my view.
Well,
Sure, good addendum. I think we also have to stand up for high quality research. I think the whole field of epidemiology is being corrupted today by the data scientists because there are so many amateur epidemiologists publishing data one after another, which is probably at best meaningless and at worst dangerous. I'm serious about this. So we have to stand up for high quality research going forward. In the face of too many amateur epidemiologists sort of mucking around in databases and extracting conclusions that are erroneous.
thank you for that. Now, again, the questions have been just wonderful. I'm going to consolidate a group of questions into one question here, and perhaps, Steph, you might be able to respond to this. The dean was commenting that he doesn't get called by the secretary, but the alumni are often called. What can the school offer to get a dialogue between alumni and faculty to make closer, meaningful engagement?
Sure, I thought I was going to get to answer the previous question. I think that's actually an interesting and provocative question. And there's a nascent program at the school which focuses on engaging alumni through mentoring. But I think that there is an enormous untapped resource, which is the alumni of our school. And we have fabulous work in the years that I've been here from our Public Health Alumni Association board. But it is really the work of those dedicated individuals working in that group. And we have not yet cracked the nut of how to mobilize and engage our broad alumni. To be honest, it's a problem that Berkeley has as a whole. It's not only the School of Public Health. We have 450,000 alumni as a university. And it turns out that a substantial number of alumni of Berkeley who are not alumni of the School of Public Health are also very influential in the health-related space. And we also need to do a better job of engaging those alumni. I mean, one of the things that I've had some discussions about with my fellow deans is the number of health sciences professionals who are alumni of Berkeley who may feel a strong connection to health in Berkeley, but not necessarily to chemistry or sociology or history or whatever they graduated in originally. And we need to figure out a way to engage them better. One of the things that we've been talking about over the last couple of years, I also often draw the analogy to medicine, where in medicine, you do half of your training in the classroom and half of your training embedded in the workplace as a clinical clerkship. In public health, we spend 2 years in the classroom and 1 summer embedded. And how could we do a better job of embedding? And the avenue to do a better job of embedding is certainly through our alumni. So I think that there's an opportunity in the educational space, I think there's an opportunity in the research space, and there's certainly an opportunity in the policy space as the questioner is suggesting. And I think the challenge for us is to figure out how do you build that infrastructure, how do you build that connectivity? And I wouldn't be dean without mentioning that, parentheses, it would also help us in the development space. So there are multiple reasons for us to do that. I'm not sitting here, Madhu's sitting in the front table. What he did is bundle, as a bundler, sorry for using a political analogy for art, we should be doing and replicating that many times over in those other spaces. So I think it's a great question and a provocative one.
So I have a very hard stop, and I'm over that hard stop, but I'd like to end on a light note. I know this event is also for you to get an opportunity to meet each other and network on your own. But to end on a much lighter note, might I ask each of the participants here, the panelists, if you care to answer this question, what do you think was the social movement, movie, song, anything that's non-academic that encapsulates the time that you were at the
So while the others are thinking about this, actually I think I tried to, we were warned that NAP might do this to us. And so I tried to think in advance of, was there a song or movie? And I really couldn't, but I said earlier, this quote from Maya Angelou, I think it was her, is do the best you can until you know better, and then when you know better, do better. And that sums up, I think, at least my experience in that this campus is such an exciting, electric, high voltage campus, right, of ideas intellectually and action, that what you think is going to happen next week doesn't happen, and things you think are going to happen, they fool you as well. So you constantly have to be in a position of flexibility, of learning, of trying something else, of failing, actually, right? Until you get it right or you win something and then you build on that. And I think her words about do the best you can till there's something better, then try to do better, kind of sums up my experience.
Thank you.
Well, I guess for me, a movie made in 1968. I was the dean from 1998 to 2002. Does anybody remember a movie from 1968? 2001, the Stanley Kubrick movie. Starting in the School of Public Health was a little bit like the apes surrounding the monolith, trying to figure out what the monolith is all about, because the school is a complicated organism, for sure. But thinking back, HAL was an interactive computer with a voice. I mean, and the era when I was being here was the era of the dot-com boom and the dot-com bust. You may remember there were at least drpoop.com was the main close thing. There were lots of websites spawned where people thought they were going to make money peddling health information. None of them ended up doing that. I think they're all gone today, but it's been incorporated into many
the wellness today.
So certainly the biggest influence and the biggest change in society was that period where the internet became very important. And public health, I think, changed forever during that time.
And I was hoping to be lighthearted, but you had social movement, and there's just one answer, I think. And that is that while I was dean, Black Lives Matter happened. And I'm kind of embarrassed to say in some ways that the response in the school caught me completely by surprise. Because I thought to myself, Black Lives Matter is about the country waking up to violence against our African American population and mass incarceration. But people in public health have known about that for years. It's no surprise for us. So I expected us to watch the country respond. I didn't expect a response within the school. And it was a huge response within the school. And to this day, I don't fully understand the reason that what happened, that it created the response that it did within the school, but it ended up being a really important and beneficial one for us. We started monthly town hall meetings on racism, equity, and privilege, and it was part also of Berkeley more broadly recognizing that the idea that we are better, that we are privileged, the problems that affect America as a whole don't affect us because we're progressive and we're the birth of the free speech movement, and we're the birthplace of all kinds of things that are progressive in America, that we don't have these problems internally. And that is so not true. And Black Lives Matter forced us to confront that within ourselves. And so I think that was really the defining thing. I mean, of course, after that you had Trump, and after that you had Me Too, and you had lots of things within my leadership that are really important social movements. But it started with what happened in the school with Black Lives Matter.
Thank you.
I tried desperately to end on a high note. But she says, try again. That's Joyce School. We are involved in a profession that requires us to be ever present. And sometimes the presence of the moment is not to be jovial, so I'll say, enjoy your meal and get to know each other better. Thank you very much.
So just one more item. This is an action item now, and you all have this here, right? And on the back is the opportunity for you to shape not just the 2030, but the next 75 years in terms of making a commitment to the values of our school and to our students in terms of a gift, friends that you know, companies that can match, etc. My wife and I have had the opportunity to do this. We're able to get a match from a major donor to the school, and in turn, we're able to get the campus to match that. And so there are ways that this has kind of a trickle effect as well. So I do want to highlight on the back here before you leave today, an action step that you can take is to indicate exactly, there it is to indicate something that you can do for the next generation of public health scholars and doers. Thank you.